Meet Yesenia Rivas, aspiring dancer, actress, choreographer, and undergraduate student at Tufts University in Medford, Massachusetts. Her original orthodontist and oral surgeon both insisted that reconstructive jaw surgery was the only option available to correct Yesenia's severe underbite condition. Through a series of seemingly unrelated events, Yesenia and her parents discovered Dr. King's practice and learned that there was actually a non-invasive alternative to surgery that could bring a positive outcome without all the inherent risks.
I first met Dr. King when I started dance classes at Ballet Conservatory of South Texas, and her daughter Bethany also dances there, and she began talking with my mom because she noticed that I had an underbite from just looking at me, and she started talking to my mom about how she does procedures to help fix that.
Initially, however, Yesenia was not hopeful that Dr. King could help or that there were any alternatives to the surgery she was facing.
When I first came, I was actually really doubtful. I didn't believe that she could help me. I have seen 2 other orthodontists before. One was in the Valley, and he was my first orthodontist, and he was the one that put the braces on me at the beginning. And at first he told me that I would need the surgery in order to fix my jaw because there was no procedure other than that. And then we didn't really want to believe him because it was such a scary procedure and such a scary thought of having my whole jaw removed. And so we decided to go see an orthodontist my aunt referred to us, and she told me the same thing, that it was a bone deformity and that there is only the surgical way to fix my jaw.
With the prospect of surgery still lingering in her future, Yesenia and her parents decided to go forward with the first step of braces to try and mitigate some of Yesenia's jaw issues.
Once I got my braces on in the Valley, the orthodontist had told me that my jaw was going to get much worse before it could get better, and it started to get much worse. It started to really stick out far, and I never took too much thought into it because I was thinking, okay, it's gonna get better. He said it's gonna get worse before it can get better, but it started affecting me when people started teasing me about it, and I'm not the type to show people like if I'm hurt, so they would make fun of me and I would laugh. I'd be like, oh, okay, but then I would go home and I would feel so low about myself. I didn't feel good. I felt so horrible. I would just go home and try and be in my room the entire time, and it was really bad. And it wasn't only friends. I had some family people who I could tell that they were making fun of me. They would make little comments and little remarks, and again I would try and be like, oh, haha, like that's funny, but inside it was really hurt, and I always felt so uncomfortable with the way I looked because I knew my jaw was sticking out, that it looked awkward, that it didn't look normal the way everybody else's did, and it just made me feel really insecure about myself.
Yesenia's concern with her condition continued to deepen after consulting with the oral surgeon her orthodontist recommended.
The orthodontist in the Valley had also referred me to an oral surgeon to have the procedure done, the surgical procedure. And when the first time we visited him, he said, oh, we're not going to do it right now because you're too young. I was 16 at the time. He says, you're too young. If we try and do this procedure now, your jaw will just move again, and then you'll have to do the surgery again. So then we were like, oh, okay, it's not going to happen now, so it'll happen later. So we were a little bit more confident about it. But then the second time we went to go visit, he started saying that we were going to have to start doing the procedure soon, and that it wasn't only going to be my lower jaw, that it was going to have to be my top jaw as well, because I had what was called a flat face syndrome. So now he had changed it to the bottom and the top, and that was really starting to scare me because he had changed his mind and so quickly from saying I didn't need it right now and it was only the bottom to it's going to have to be both. And then the third time we visited, he had said that we were going to have to do both again, but that this time it was going to be the top jaw moving more than the bottom jaw.
These are the cases that everyone is saying that surgery is the only choice. And for some that maybe don't have the finances, it can be $30,000 sometimes. It's unfortunate that there's a sense of hopelessness, if you can't go through that. But also, there's somewhat of a fear of having the jaws sectioned. In this case, it would be a two-jaw surgery, and sectioning the upper jaw influences so many other cranial bones.
The surgeon told me that if a nerve was cut, that my mouth could go numb, and that I would basically lose some of the capabilities, and that there was a chance after the first 2 months of the procedure that I wouldn't be able to really talk or eat anything because my mouth really wouldn't be able to move so that it could heal. And that just really, really scared me. At that point, I knew for sure that I did not want the surgery at all. He had just scared me so badly.
But hope was just around the corner for Yesenia and her parents.
Dr. King gave me a lot of hope about it. The first meeting that we came in, she just saw my jaw, and right away she's like, "Oh yes, we can fix it, I know exactly what to do." And it was really reassuring to hear that I didn't need the surgery after 2 orthodontists had told me that I did need a surgery and that I did have to have it. It was such a relief to hear that she could fix it without having to do that procedure.
In this case, a simple little wire appliance called an advanced light wire functional was placed, and it's one that you really can't see. You might see a little bit of a wire on the sides, but you can't see it for the most part. And this patient wore this for about a year and corrected this very severe malocclusion. But it was also a very severe deficiency of the mid-face. She was at an age where you wouldn't expect this to correct, because age 15, I think, it's in a girl, you wouldn't expect to be able to correct something like this. She corrected most of it with just these simple wire appliances. Then at the end, there were a few braces for a very short time to align the teeth.
Amazingly enough, Yesenia's treatment with Dr. King showed positive results overnight.
The first procedure that Dr. King really did to help my situation was she gave me this headgear that I had to wear at night, and it attached to these 2 wires on the front of my teeth, and it was rubber bands, and it would basically, I guess, pull the top jaw out to help it better fit. And I remember the first night after I wore it, I woke up and I was excited, and I touched my teeth to see how they were, and my jaw had already literally moved in front of my bottom teeth. My top jaw had moved. It was not an underbite anymore. And I was so excited, and I ran and told my mom, and I was like, Mom, look, it's fixed now, like it moved in front of it. And my mom was like, no, Yesenia, it didn't happen. It can't happen overnight. So I was just kind of like, oh, okay, well, I guess. And then so I went to school and I went to dance, and then we had to come to the dentist afterwards so they could fix something. And the moment Dr. King looked at my teeth, she was like, "Oh, it moved, your teeth moved, they're over your other teeth." And I was just like, "See, Mom, it happened. I knew it could happen." And so that was also a really big leap of hope for me, because it had already happened over one night.
In the months ahead, Yesenia not only began to see an improvement in her jaw position, but she began to experience an increase in her personal confidence as well.
Before I had the procedure, I was kind of confident, as in I could go out and I could hang with my friends, and I was never really a shy person. But when it would come to taking pictures or anything like that, I would always try to avoid smiling, because I was never really comfortable with my smile. So all my pictures would be silly faces and just anything but a smile. I would really, really try to avoid smiling. And after the procedure, it's like now I want to smile in pictures. Now I just feel so much more confident with the way I look, because I know my jaw's fixed and that I have a good jaw now.
The proper alignment of Yesenia's jaw also brought additional benefits.
I am definitely able to think better. Before, with my jaw, I would always get really bad headaches whenever I was doing homework or during any time, and I would have to stop and rest my head because I just had really bad headaches. And after the procedure, I hardly ever get headaches. I would say I get about 1 a month, and that's probably just from stress, but my headaches went away, and it just made studying and doing work so much easier.
Yesenia's treatment with Dr. King not only resulted in greater personal confidence and mental focus, but gave her an increased edge with one of her greatest loves, dance.
The procedure that Dr. King did to me also really helped me with my dancing. I do ballet, and as part of ballet, a big part of that is to be able to balance. And before I was okay at balancing, but I always found that I had difficulties trying to keep my balance. And then after the procedure was finished, it just really started to help improving my dance. I found that I could balance easier and that it was easier for me to dance because my jaw was now in place. And Dr. King says that the jaw really affects the way you hold yourself and the way you stand. And it was really, really apparent when I started to dance because balancing just came so much easier for me.
But Yesenia and her parents were not the only ones who noticed a change.
Others have been completely astonished with what they've seen happen to me. My own family would say like, "Oh, you're related to Jay Leno with your mouth," and now it's just like, "Wow, you have a completely different smile. Your jaw is just completely different." Some of my friends, a couple of days after the procedure, like after everything happened, they were like, "Yesenia, something looks different with your face. Like it looks better. You just look more put together." So others have noticed it, and they're just really astonished that all of this has happened without the surgical procedure.
The results speak for themselves. A journey that began in fear and hopelessness is now continuing on with great hope and aspirations for the future.
After seeing the results from my treatment, I feel much more confident in myself. I feel I can go out and pursue my dreams and achieve everything because I feel more confident in myself. I would say to someone that has the similar orthodontic challenge as myself that you don't have to do the surgery. If you don't feel comfortable in doing the surgery and you can't afford it, don't feel that that's your only option. There is always this hope that you can do it another way. I mean, I didn't have to have the surgical procedure, and my jaw is what they call a perfect jaw now, and I didn't have to do the surgical procedure, and I found this hope.
As of the date of this presentation, Yesenia is continuing her studies and pursuits at Tufts University. Upon graduation, she plans to pursue a career as an actress and an attorney.